Fantastic. So please, my name is Katie Smith-Milway. I'm the president of the INDEVOR Global Club, which fosters INSEAD alumni engagement around sustainability, including both environmental and social and economic. And we are just delighted today to have with us an amazing panel. I'm going to flash up a slide right now and briefly introduce them, and then share. Except I want to get us onto. There we go. Briefly introduce folks, and then we're going to have an amazing conversation. Let me just start by thanking the sponsor for this webinar, which is SATVA. They are a social impact consultancy out of India, founded by INSEAD alum Krishna Sridhar Murthy. And one of my favorite things about SATVA is when you go to their website, the About Us says, it's not about us, because they really do put a lot of empathy and collaboration into all they do, head and heart. And they help nonprofits, they help foundations, they help businesses with needs related to sustainability and from strategy to implementation. And they're in a terrific organization. We're very grateful they've sponsored this webinar. We're also grateful for our co-promoters, the Hoffman Institute, the Women in Business Club, Healthcare Club, and then US and France NAAs. So thanks to all of you, and for those who are here joining us. The topic is business strategies in response to diminishing humanitarian support, which is just a crisis issue right now. And to parse the issue and think through some of the promising pathways, we have a really amazing panel led by Professor Luc Van Wassenov, who's many of you will know is a long, strong expert in supply chains and manufacturing, but he also leads INSEAD's humanitarian research group. We also have Dr. Kelechi Ohiri, who's the Director General and CEO of the National Health Insurance Authority in Nigeria, founded 2 decades ago. They are part of the security net there, and they have very much been at the center of strategies to, sort of respond to diminishing official development assistance. Karen Hitchke from Building Bridges, which works across nonprofits and corporations to look at strategies for collaboration. And Veronica Denti from Gavi, which is the Global Vaccine Alliance, whose business is to bring low-cost vaccines to children in countries that need it. And she has directed 2 of their largest programs. They'll each tell you a little bit more about what they're doing when they present. And the structure today is going to be about 5 minutes from each of our experts. They're going to have a conversation amongst each other because they each do different things, and there's going to be some really interesting collective learning, and then we'll open it up for Q&A from folks who are on the call. So let me get started with inviting Luc to introduce himself. I'm going to go to I'm going to go off screen for a sec, Luc, so that you can just chat with people, and then I'll throw up his slide and he'll start telling you about, unfortunately, our first topic, how bad it really is.
Yeah, hi, Katie, and hi, everybody on the call. Thank you for joining. Yeah, so I'm running the humanitarian research group at INSEAD, and the group has existed for almost 25 years. We've done a lot of projects and still do a lot of projects with humanitarian organizations. We look at collaboration between humanitarian organizations, which is not always that easy. We have also done a lot of work on partnerships between humanitarian organizations and business, and that will be also part of this panel, but you will realize that even there, things are not that obvious, so that's exactly what we're going to talk about. How can we make sure that that can go better in the future? So if you don't mind putting up my first slide, Katie?
Absolutely.
Or Nicole?
No, I got it. Moving to that. Oh, sorry. Let me have to trying to advance it. There we go.
Thank you. So you asked me, to tell something about how bad it is. So, it's a bloody time. What can I tell you? And these are not my words. These are the words of Abhijit Banerjee and Esther Duflo. As you know, recent Nobel Prize laureates and experts in the field. So who am I to contradict them or argue with them, right? So, there's some rough data there, but things are much worse than on these rough data in terms of the impact and the budget cuts and the job losses and the NGOs that have to fold because of this shock wave. And it's not just because of USAID, it's also about 30% of the budgets being cut in Europe for all sorts of reasons in Germany and UK and other countries. So it's bad. I mean, if that would happen to business, it would be a complete disaster, and it is also a disaster for the humanitarian world. Now, it's bad for the humanitarian world, but the real impact is, of course, on the millions of people that are affected by this thing. And, there will be millions of avoidable deaths. Just think about, the classical malaria, polio, HIV programs in the world that will suffer enormously. Now, of course, these people will be the victims of all of this, but we're also concerned because if we stop or reduce the surveillance programs down, we will be, and when I say we, I mean the rich world, we will be very much more vulnerable to all sorts of disease outbreaks and perhaps epidemics or even pandemics. And at the end of the day, if people are hungry and unhealthy and they are not being helped and they get a poor education, then it has a big impact on business. I mean, the economy cannot function, business cannot function. So we're all very much concerned. But to me, the biggest thing is really, what about humanity? Is this the world we want to live in? No, it is not. We don't want to go back to the Middle Ages. We don't want to go back to triage where you have to decide on who's going to stay alive and who's going to, be left behind. That being said, the old system is, of course, completely gone. There's no way that the system that we knew it, given the current turbulence, the bloody time, will go back to, the old ways of doing things. So we need to have a reset, and the reset, of course, there are a lot of challenges. I don't have to emphasize that. If your budget as an organization is being cut by 60%, you have a challenge. But there are also opportunities, and hopefully this panel can talk a little bit more about the opportunities. The thing that we also have to reset is what, Banerjee and DeFlo are saying. We have to agree, all of us, that human lives matter, no matter where you are and no matter who they are. And this is sometimes forgotten. And so this is the number one rule. And the number two reset rule is basically we have to find the best way to spend a dollar. And that's not always been obvious in the previous system. It will be necessary in the future system. So that means sort of a different mindset, going from fundraising, finding money, donations, to really performance-based. It will need some sort of a shift from effort and goodwill to evidence-based impact. And that is very much, akin to how business operates. So that's the link with hopefully the rest of the panel. How can business and perhaps maybe also those strange academics help a little bit to improve things? So I'll stop here and go back to Katie.
Okay, thank you very much. We're going to pass through your next slide is looking at some of the pathways forward. And we're just going to give people a blink at this because as we move into talking with our other panelists, they'll be keen into some of these pathways. Do you want to say just anything, Luke?
Yes, the thing I want to say is that I'm an operations person. I'm a supply chain person. I like strategy. I like strategic intent, but I'm sort of, where's the beef? How are we going to do this? And we shouldn't be too naive about doing these things and getting a big positive impact. I think we'll have to be very smart in selecting the right projects, given that people are in crisis mode and don't have too many resources. And we'll have to build conduits, right? So that organizations can be interoperable, because business and humanitarian organizations have very different ways of operating. We'll also have to build systems, to support these conduits. We'll have to have more, attention and impact on building local capabilities, because those are the ones that need to execute. We have to reduce complexity because, many of these systems are much too complex. In the first place, donor relations and donor demands are much too complex. So, building bridges is what we need to do. And that's what will be at the forefront of this panel. And the question is very simple, right? Why do we need to do this? Well, it's simply the right thing to do. It's about humanity.
Okay, thank you so much. So with that, let's move to actually Karen, who is all about building bridges. And I'm going to move forward to your slide. And I'm going to ask, I know Dr. O'Heary's had a little trouble getting on this morning, so I'm going to ask Nicole to flag for me once he's on, and we'll go to his slide. But Karen, why don't you tell people more about what you do and this example of building bridges?
Sure. First of all, before I even go into that deep dive example, just a little bit taking a step back. So obviously we've been just speaking about diminishing humanitarian support. What is also what the very abrupt change in terms of support from USAID, of course, but also other basically other development funding has shown is a huge dependency of many countries of that whole sector on donations, on grants, on public funding. If you just look at some of the Economist data that came out from some articles when USAID pulled out in Africa, there are two countries, in fact, which receive between 25 and 50% of their gross national income is from public funding. It's from developmental aid. There are 10 countries where between 10 and 25% of their gross national income is from development aid. That is massive. There's a huge dependency overall, if you just think big picture, of on public funding and grants. And then, of course, very concretely, we know examples of Veronica here from Gavi, the cutbacks, the immediate cutbacks on vaccinations, the Global Fund, tuberculosis, malaria, AIDS program have been stalled immediately. Local NGOs have gone bankrupt because they were not funded. So there's a lot of there's cutting staff, the whole program is being cut. Other countries are cutting money as well. So what we're seeing is, of course, a huge call for private investment. But I think we also need to be very realistic. Private investment, so how do we use private funding, not just be more efficient with public and philanthropic funding, but also how do we leverage better the private sector to come in, corporates and financial investments. But that's not going to replace grant funding in that sense, and not overnight. It's a different type. It's an investment. It's not a, it's not a subsidy in that sense, because private capital really acts very differently. And that is really what Building Bridges is about. What we are a conference and a foundation that really has at its core multi-stakeholder collaboration. So how do we bridge these very different sectors of for-profit, the non-profit sector, financial investments, United Nations, the state. And we do that in Geneva, which in a way is that microcosm that reflects the real world, because you have them all basically in one place in a relatively small city, all these different organizations. So we started out in 2019 as a conference. We're now a foundation, and what we do either as a conference, but also behind closed doors, we really bring these different stakeholders together and want to work on how do we need to collaborate and really utilize each other's strengths and create a framework where we can basically build an ecosystem where each of these players have their role. That's what we're doing at Building Bridges. And the purpose, of course, how can we move more private investment that we need to leverage into the sector towards sustainability, towards the SDGs and the humanitarian sector. Health is a huge element of that, of course, as is climate, but we're not going to talk too much about that. And just very quickly, personally, before I go into that example, because I really want to share that. So I've been in the for-profit sector. I've been an investor, venture capital, private actor for 10 years. I've been in impact investing for about 10 years. In the last 5 years, I've been in philanthropy before I was joining Building Bridges. So I've kind of lived through these different worlds, and I see how disconnected very often they are, but how important, on the other hand, if it works, if we really want to make money move, if we want to rethink the system, we need to really make sure these sectors collaborate with each other. And now let me now move to that example just to show you how that can be done, because there are really examples out there already. So, and I love this medical credit fund. Was set up several years ago. What it does, it provides debt financing and support for health-related small and medium-sized enterprises in Africa. Was established in 2009 as part of the Farm Access Group. That's a Dutch nonprofit. And it's a debt fund that specializes in health in Africa and provides loans to healthcare providers, for-profit healthcare providers. So those are not public entities, they are corporates in a sense, but small, which are serving lower income groups. And very often they are not in first-tier cities, which are the ones who are usually in the limelight and who are getting most of the public funding. But these are very often second and third-tier cities, but they're very important if you want to get primary healthcare access and if you really want to spread the system across the countries, basically the country. It's a blended fund structure, which means it combines grants and investments. It got about 40 million, a little bit less committed capital from public funds, Dutch government, FMO, the British Investment Fund, SWED Fund. There's a guarantee facility by the DFC, but then also for-profit investors, proper investors like the corporate Philips, for example, but also for-profit investors added to that fund, so that they were able to disperse 170 million loans to 2,000 health facilities, small health facilities across the African continent. So the countries are out there. And what are these loans for? They are really to upgrade these. They can either be working capital, which basically means just to provide the liquidity for these entities, for the small hospitals and clinics. But they can also be reinvestments in infrastructure and equipment to upgrade the quality of these facilities. And then they are paid back over time. So it's a real investment. It's not a grant. These entities make money. They have a revenue stream, and they will repay those loans over time, and then they can be recycled. And then the size is different. So it could be smaller amounts up to 300,000 of euros, not just equivalency, but there are also real investment, longer term loans, which can come up to 5 million. In combination, to make sure the money is well deployed and these facilities are upgraded, they provide technical assistance. That's again a grant, not an investment. So to make sure that there are really the right business improvements to help those entities to really do that well. And Farm Access Group and Medical Credit Fund have basically developed certain standards to make sure that these loans are well deployed. And I think I love this example because it brings everything together. It's philanthropy, providing technical assistance. It's a guarantee that provides a risk buffer. It's public funding that kind of also is risk absorption. And then you have private investment. So basically you have them all together. They play together, they work together to really mobilize money. And that's how we can also maximize the inflow of investments, of overall funding into the sector. And I just leave it there, and I think then have more examples that I love, but I wanted to start with this one here.
So that's a very exciting example, Karen. And when I did a prep call with Dr. O'Leary, he's very familiar with this. I can see you're working in Nigeria, and he's very familiar with it and says it works very well, and that blended finance is in fact one of the really important pathways forward for Nigeria. So Nicole, I can't see the chat while I'm sharing, so if you can just flag if Dr. O'Leary arrives, I'll move to his slides at that time. Thanks. But let's move on now to Veronica and Gavi.
Thank you so much. Can you hear me clearly? Thank you. So as a brief introduction, I'm super happy to be here. I've worked with Gavi for a decade, looking after the pneumonia and the rotavirus vaccine programs. This might not say a lot to you, but those are the biggest by investment value, volume, innovation, and impact. And I'm now on a sabbatical for an academic research project since a month. So starting a bit of a new project. And I love some of the keywords that Luke and Karen and yourself, Katie, have shared, which are investment, which are co-funding, which are evidence-based impact, and really also what is the best money that a single dollar can buy, because Gavi is a great example for all of this. Gavi is an alliance. It's a private-public alliance that brings together UNICEF, and I think we have somebody from UNICEF in the audience today, the Gates Foundation, the World Health Organization, the World Bank, to help catalyze funding to immunize more than half of the world's children against more than 20 diseases. In terms of impact, it's over 1 billion children vaccinated in 25 years, and we aim to vaccinate 500 million in the next 10. So accelerating a lot of the impact if funding keeps up. And the result of this has been so far 19 million deaths averted or lives saved. And in specific, a return on investment of 54. You invest $1 and you get $54 of economic benefit back. Is one of the best buys of all time, certainly in health, and definitely in terms of philanthropic and also private investment. A key aspect of this model, the alliance model, so you bring multiple partnerships, multiple powers together, the power to attract funding from governments and private institutions to the tune of billions. We do this every 5 years. And right now is one of those cycles. You can imagine it's been a struggle like never before. And we enable this to pool demand. Pooling demand across more than 70 countries enables to get the best prices, by far the best prices. We can get vaccines at $2 a dose that would cost $100 in other countries. So this enables really a big volume gain with a big impact. But the biggest piece here that I love is, like you were saying, Karen, not everything is philanthropy. It's a co-funding model. Every country must co-pay, from a little bit to a lot, to everything. As the country GDP grows, their co-share grows. And we've seen the model succeed because as of now, 19 countries, one of them is China, Indonesia, Vietnam, have graduated out of the model and are fully funding their immunization programs. So it's a catalytic power that brings together aggregation of demand, security of funding, enabling the manufacturing to keep investing in scaling up vaccine production. Scaling up reduces the prices, it makes it affordable, and it's a virtuous cycle that enables countries with better health to lift themselves up in terms of GDP. Now, all of this is one of the best stories in health, but the current crisis that we're facing, and I have to say, Gavi is facing right now more challenges than ever before, because even a reduction in what might seem little, 15% of what we hope to fundraise for the next 5-year cycle, this would lead in 75 million children missing out on routine vaccines. This would lead to more than 1 million children dying. I mean, we're talking 1 million children. It's massive. And that's just a 15% of investment gap. So if we think about where should we put the scarce resources first from a financial perspective, I would definitely say, please consider vaccination as one of the first ones, but also consider the model of how to make sure that the investment is evidence-based and brings together forces of multi-stakeholders. And second, this doesn't only impact children in low and middle income countries. You know, we're hearing, look, about an increase in security, an increase in defense spending. Well, security is also health security. And Gavi invests in preparedness against outbreaks. An outbreak of Ebola, an outbreak of Mpox spreads, it doesn't know any borders. So because we can invest and motivate manufacturers to keep stockpiles of these vaccines at risk before they're needed, we help keeping the entire world safe. And I think that is definitely one of the examples where the beneficiaries are all over, the humanitarian cause where you help save at the acute area of an outbreak, that has actual benefits for all the donor governments that are invited to contribute into this investment as well. We've also learned from a COVID crisis that we have a definitive necessity for regionalized vaccine manufacturing. So there has been a huge investment, $1 billion, to support African vaccine manufacturing being set up. And this also could be at risk of being slower than expected. Imagine vaccines made in Africa for Africa. There is definitely an opportunity to be an ally in catalyzing also what you were showing in the earlier slide, building local capacity. That's exactly what is meant. Putting the dollars, putting the facilities, enabling the people to build it and establishing the regulatory frameworks that enable this to be set up. It's a huge investment. It's not going to happen in a couple of years. But if we cut it out of our funding today, it's going to be delayed. It remains a vision. It doesn't get implemented. And this has repercussions for the safety of the entire world. So in terms of how the private sector can help, one is very simple and very accessible to everyone in the audience today as well. Be vocal. We cannot be silent in a crisis, especially not if we're from INSEAD and such a valuable network of alumni. We need to be vocal about the value of supporting every country and supporting particularly causes that will come back to bite us if we forget about them now. And one of them is Gavi, and then there are other investments. We heard about the Global Fund as well. Please be vocal about this in your social networks. We've seen a lot of private voices from the big manufacturers, from the pharmaceutical associations as well, from WHO, stating the value of preserving the benefits that took decades to build immunization systems, to build trust in immunization, to build incentives for manufacturers to build the volume. It didn't happen overnight. It took decades. We're there. We can't let it crash. Second, in order to build manufacturing capacity, there has been advanced market commitments. One of them was the one that I looked after for pneumonia at its last years. It lasted a decade, and it enabled Pfizer, GSK, and a big Indian manufacturer to build up scale and lower prices. This enabled to vaccinate so many more million children across 60 countries that can access the vaccine for one of the top 3 killers of children under 5 today. This is another example where the partnership between the public and the private can really bring innovation forward and benefits for everyone. Another plea is to the manufacturers themselves. If there is uncertainty of demand, at times,
Veronica, you've frozen.
Can you hear me now?
No, she's fine. I can hear well.
Okay.
And see you well. For me, you're still moving.
If that's okay, I would have another minute or two.
Sorry, I think I froze. I thought you had frozen, but I think it was me.
No problem. No problem. We got the audience attention back in case. And I was at keeping stable prices. If there are fluctuations in demand, which we're not seeing yet, but which might happen as a repercussion, there are commitments to volumes and to prices. We need stability in crisis as long as possible. Every month helps. The more stability, the more UNICEF can help us procure and keep vaccines flowing to the countries in these moments of need. The second is technical expertise. I've seen in February and in March, colleagues that I've worked with for years literally vanish overnight. My colleagues at CDC, colleagues that were seconded to WHO, gone. And suddenly those are the voices that were experts in particular disease areas, and you need to scramble to find someone else to replace them. We need to build that expertise locally and regionally more to avoid these traumatic events happening again, because that leaves dozens of countries at a loss for technical guidance. So you might have the new products, but you may not have the trainings to be able to implement them effectively and safely as you should. So that's another area where the technical expertise must be kept up. Now we have a temporary shock, hopefully we can get the talent back in the system and make sure that we don't lose that technical expertise. And finally, there's also a silver lining. There's been huge investments in Indian-made vaccines that, as some of you may know, are the #1 by volume, by far, manufacturers of the world and for vaccines. And there are opportunities to optimize vaccine investments by selecting equivalent vaccines that cost 30 to 65% less. These have been available for 5 years now. Several pioneering countries like Ghana, like Kenya, like Uzbekistan already started adopting them. India, of course, because they're locally made, and they have seen huge financial benefits. Nigeria is another one, by transitioning and having a mix of known manufacturers and new manufacturers. And this really enables getting even further in terms of impact and efficiency and return on investments. Thank you, Katie. Back to you.
Amazing. Thank you. Thank you so much, Veronica. Just going back to Luke's slide here, I'm going to stop sharing and bring us all into conversation. And I'll just channel Dr. O'Heary's talk he gave at Skull World Forum, which I was privileged to hear, and the prep call we had, to say a few things about the view from Nigeria. Unless by any chance one of the iPhones is Dr. O'Heary. Is there any sign of him?
Hi, Katie. I've joined the call.
Oh, he is here. Awesome. Okay, Dr. O'Heary, speak for yourself. If you could
Sure.
just tell us a little bit about the authority and the National Health Insurance Authority and what you're doing.
Hi, I'm not sure if you can see me clearly from here. I mean, I don't know if you have I think we can send a slide to you.
Yep, I can put that up. Yep, absolutely.
Yes, I'll just speak just briefly to it. Well, thanks for the opportunity to join, and really apologies. One of the drawbacks one of the things you have to deal with when you're in public service is, the legislator. So I had a meeting with the senator and the chairman of my committee. That's Randall. But just quickly, to save time, I'll just touch on 4 things. One would be the way we interpreted the crisis in Nigeria, how Nigeria has responded so far. I'll also give a brief background on the National Health Insurance Authority. And then lastly, since we are having this session in the context of business school, where I see opportunities for the private sector. So just quickly, in Nigeria, this came as a shock as it came to many countries, but it felt like the COVID pandemic had sort of primed many countries in Africa, Nigeria in particular, with the fact that what we understand to be the way the world order is maintained may not always hold, right? And I think during COVID, a lot of African countries began to seek alternative ways of accessing, commodities, vaccines, etc. And so the conversations around, localization of everything began to take hold. Now, it's important to note that roughly slightly less than a quarter of health expenditure in Nigeria is from official development assistance. And this comes from bilaterals, multilaterals, foundations, and many of the global health initiatives that support Nigeria. And in the US, the case of the US particularly, about $6.4 billion had been spent over the last decade. In 2024, that number was about $420 million that was dispersed to the health sector across multiple programs from the USAID, the USABC, etc. This doesn't include, indirect financing that is channeled through some of the multilateral institutions. And so when the freeze came from not just the US government, but from other governments, the UK, etc., who also announced a reduction in development assistance. I think, like everyone, I think we went through the different cycles, right, of, not cycles of grief, right, but those different phases of first shock, then maybe some confusion, and then some form of resignation, and then action. But I think we went through the phases very quickly, right, in Nigeria. And I do recognize that some other countries may not have the resources like Nigeria did to actually, go through things. And so the implication was that, one, we lost critical funding to finance a lot of healthcare obligations, treatments for people, particularly people living with HIV/AIDS and TB, for the programs that were supported, but there are also other programs across the country, so they all came to a halt abruptly and immediately. That led to a disruption in planning and in service delivery. So that interruption was real in many cases, and I'm not sure we've all, fully gotten to the bottom of its real impact. I think maybe in the months and years to come, the stories will start emerging. Well, the other thing that was lost that is not spoken of very often is, the technical assistance that came with the support, but also the accountability that came with a lot of the key programs, right? When you're forced to actually make reports and everything, it builds a system and a virtual cycle of accountability that's also lost with that. So I'm not one of those that would say, well, good riddance. No, absolutely. There was a lot of help, for which, we are grateful for the support and for the generosity of those who have supported Nigeria over time. But also, we can't keep crying and stay in shock. We have to also respond and begin to do certain things. So that has led to the Nigeria's response, so the second quadrant. Now, prior to this, Nigeria has set up a sector-wide approach led by the Minister of Health. And this was a strategy to give proper visibility to what all the different partners are doing in Nigeria, in addition to government's own resources. The key element of it was just better coordination, having more accountability mechanisms that was government-led, but also beginning to look at how we could pool resources with government funds as well as donor funding, and then be better at channeling resources to where there were needs. So even prioritization was done in the context of strategic framework that was done. So that helped, I guess, Nigeria in its recovery. And the second thing was that there was a lot of advocacy, and Nigerian government approved additional $200 million because we did realize that there was a funding gap, and a lot of it, I think roughly 70% based on our calculations, was targeted at commodities really and consumables. And so that had to happen. The other thing that was really important was the health workers that were supported. I think there were roughly about 28,000 of them. Some of them were ad hoc staff, some of them were clinicians who were working in places. So the government set up a program where it has absorbed some at the federal government level and at the state absorbing some of the workers. So the plan is to absorb, if not all, but most of the health workers, particularly those in the front line providing clinical services, to mitigate the disruption. And then there were additional, a lot of advocacy went in, internal advocacy by the ministers, the government putting a lot of resources into the health budget to actually, stop that loss and that cliff. And now the government also developed a strategy where there was the immediate term strategy, which is really around risk mitigation and mitigating the impact of the interruptions. But there's a medium-term 2 to 3 year strategy being developed where we're looking at, well, how can we sustain this, right? And then the longer-term strategy we need to reimagine, because we don't anticipate that we will go back to normal or to what was ex ante. So that means we now need to prepare for a new reality, which means we need to really think of how we prioritize. We need to really have other conversations about efficiency, which has come up as a critical thing that we need to look at in how we are providing support to the health sector. And so the SWAP sector-wide approach has been very helpful in that. And then thirdly, the private sector has been engaged. So the PVAC stands for the Presidential Initiative for Unlocking the Healthcare Value Chain. And that's led by a colleague of mine from the private sector. And what it started looking at is how we begin to prioritize full procurement of essential medicines and commodities, working with the private sector in accelerating local manufacturing, and also seeing how the private sector can play a bigger role in digitization, etc. And to ensure that, and this was a presidential mandate, an executive order, to begin to look at not just addressing the emergency, but begin to see how the private sector and health can actually grow. And the NHI, which has been in existence for about 20 years, 3 years ago in 2022, we transformed from just being a scheme that catered mostly to the formal sector workers and began to have an expanded role as a promoter of insurance, a regulator, and integrating the various public and private health insurance schemes in the country. Now, we began to accelerate awareness creation, and a lot of activities and reforms were put in place. And in 2024, added about 3 million lives to the number of people that were covered by health insurance. And so the number went from about 16.4 million people to about 19.5 million people at the end of 2024, including 2.5 million vulnerable people who are funded out of 1% of government's consolidated revenue to make sure that we are consistently capturing and enrolling the poor. So Nigeria's path to UHC is one that is intentional on equity and ensuring that it doesn't just trickle down from the wealthy and then the middle class and then to the poor, but that government resources start getting the poor and vulnerable, and while those who can pay can contribute through their premiums as a form of contributory social safety net. We also launched some initiatives on maternal health and providing financial access to comprehensive emergency care and to reduce that barrier. And we've also begun to partner with the private sector and looking at first ensuring that not just private payers are part of what we do, but also private providers are part of that, and partnering with the presidential initiative to see how commodities, etc., are provided. Now, a lot's going on, and I'm just trying to summarize, and I'm not doing justice to it. But in terms of opportunities for the private sector, I just wanted to highlight just 3 areas of the myriad of opportunities that are there. The first of efficiency, and if there was the word salad, efficiency will come up over and over and over again. And that's because as we're rebuilding and adapting to this, it means we can't afford the inefficiencies and the wastages that existed before. And so where the private sector can bring those efficiencies to bear, for instance, the work played on good procurement, how we can minimize fragmentation, and why we don't need to reinvent the wheel, that will go a long way as part of our health sector strategy to get more value for the little money that we're spending. The second is innovation. And, you know, with COVID came a lot of innovation. And should we waste this crisis? Where can we begin to innovate? Perhaps telemedicine and alternative service delivery models can come up that will help plug the gap across many countries that can't afford to provide the same services or that the major donors were providing before. How do we partner with the telcos, for instance, to create awareness? How do we develop new products that can cater to the bottom of the pyramid in this sense? And of course, the private sector also includes the non-profits and social enterprises for whom this could be a big opportunity to actually do more. And of course, financing, but not just in terms of more money for value, but also looking at innovation in terms of innovative payment models, microinsurance, micro-lending, and also tapping into new and available financial resources from the private sector and critical social impact investments that can help complement what the public sector is doing and what's remaining of what the international development organizations are doing. So I see the private sector being a key catalyst for change and for the recovery and adaptation that many countries will have in this new phase. And so just want to highlight three of them. But overall, I think, yes, there has been a shock. Nigeria has tried its best to respond to mitigate the impact, but I think it also presents an opportunity that we should not let, fade away. And the private sector needs to lean in to see how we can actually solve some of these problems and partner with government more effectively through public-private partnerships and engagement and integration. So thank you, and I hope this gives a bit of a picture to how we're thinking about things here in Nigeria. Over.
Thank you so much, Dr. Harry. That did give us a great overview, and it also picked up threads from the prior panelists' presentations related to blended finance, the importance of keeping the vaccine train moving. Saving Gavi, I think, is something we all heard strongly and loudly. And then also the efficiencies that Luke talked about in terms of supply chain efficiencies as a very key business strategy going forward. So one of the things that is amazing about the INDEVOR webinar series is we usually have as much expertise among the registrants as we have among panelists. So I want to actually open it now in our last few minutes to questions from the registrants and I see there's a lot in the chat, to our panelists and have a real conversation about some of these pinch points, some of these opportunities, and see if we can have some focus group working out right here on the screen. Any questions? Let's see. I'm looking through. Is there a burning question over here? Yes, please post questions in the Q&A. And Nicole, I'm kind of looking to you to see, as I've been on the screen, to see what's happened well, while we're waiting for questions to come up in the Q&A, I see we've got a whole bunch of experts in the audience. Luke, do you want to reflect on anything you heard across the panel?
I think all the elements are very, very useful. A lot of this has been done, certified in the past. It works. It's just the fact to scale it up, and scaling it up takes time. And this is not the best time to do it because most people are still in sort of very difficult conditions. So if you want to talk about transformation, I think we should think about what do we do in the short term, what do we do in the medium term, and how do we build a new system in the long term? Building these bridges, Karen, is very, very important, but it's taking time, right? I mean, Gavi has been very successful, but what, 20 years, Veronica?
25.
Pardon?
25.
Yeah, sorry, 25. So that's not tomorrow. A lot of these organizations need some help today to stop the bleeding. And I think Kenichi gives some very good example of that, right? I mean, Nigeria taking over 2,800 health workers, which is great. That's the sort of stopping the bleeding type of thing that can be done. And there's many other things that could be done and where business can help, right? Then there's the medium term is really the quick wins. And what can we do? One of the things is, of course, to make sure that we don't have quick losses, Veronica. If you have a cut of 15% in what Gavi is doing, that would be pretty stupid and pretty silly, pretty stupid. But there are other things you can do in the medium term, right? You can start thinking about procurement, and Kenichi also mentioned it, and you mentioned it, Veronica. It is something that is a very important element of the budgets, and it's not done extremely efficiently all the time. There are plenty of reasons for that, and these constraints can be taken away and business can help. And then the long term, yes, those will be completely new collaboration models, public-private types of partnerships and so on. So that I just wanted to say that, and again, coming back to what I said in the beginning, we all have strong intent to do something about this current situation, but I think, from an execution perspective, you have to think about what makes sense immediately, short term, medium term, and then long term. How do we build a new system, and how do we integrate, all the different stakeholders? So over to you again. Sorry for talking so much.
No, not at all. We're going to call on Jan Willem van Broek, who has a question. And while he is asking his question, I'd like Veronica to respond to Gail Valtinger in the chat, who asks how alumni can connect in terms of providing technical expertise, advocacy. What are the platforms and institutions that they can connect to? So if you can just give folks some resources if they want to help defend Gavi or help provide, and Karen help provide technical expertise in the chat, that would be great. But over to you, Jan.
Thank you for organizing for a very interesting discussion. So my name is Jan Willem van der Broek. I work at the United Nations Population Program. So we provide also humanitarian support. It's about a third of our total work. So we make sure that women can deliver babies safely and are protected against gender-based violence in humanitarian situations. So also impacted by the current developments. So I think I agree with Luc as well that I think there's a short term here, and it will be very difficult to build new systems and be more efficient, effective as we end within the next couple of months. I think for the short term, we really defend for hopefully other donors to step up, and we're also looking at other financial sources and maybe individual giving in the shorter term to maybe fill in some of the immediate gaps. In the longer term, I'm heading a team that's looking at financing and multilateral partnership with UNFPA in New York. And there we're working, just like a lot of other organizations, already longer term on kind of financing. So how is our work, how can we bring in domestic resources and other resources to make the development more sustainable and not depending on just the donor resources? Because we unfortunately see a downward trend, especially this year, but maybe even in coming years related to ODA in general. For us, the work is mostly focused on maternal health and family planning and working with gender-based violence. So we very much work together with governments, like in Nigeria, on the swap and on micro health insurance systems. I think that's kind of the long-term support, where a lot of the focus will be to take over some of the gaps that are now existing on ODA. But it takes time to build up the systems. It takes time. I worked on Zambia on setting up the national health insurance system there. It took about 8 years before it became fully operational. There's similar projections in other countries as well. It's very difficult to bring in the informal sector in these kind of schemes. So it will take time, but hopefully we can work on that. But in the short term, I think there's still a role for the UN and other partners to bring in, especially for humanitarian. And that's very good for everyone to advocate with your governments, with other partners to say, okay, this is still an important area of work, and please support it and don't cut all the budgets on that side. So that's kind of my thoughts on that one. Thank you.
Oh, Jan, thanks for adding your wisdom and experience to the conversation. And it is it's good to hear the underscoring of the importance of the health insurance, growth in health insurance, so folks can create security, for their families, unrelated to what's happening with ODA, et cetera. There's a question that maybe Veronica and Karen, you can just respond to this question verbally, but related to what are the other really promising sources of funding that could replace ODA?
You want me to go first?
Sure, go ahead, Veronica.
Very light. I mean, both questions that you've asked are particularly tough, but I would say, can ODA be replaced as such? Like, can you fill the financial gap? I think that's very unlikely that it can happen at the speed and size that is needed to avoid the immediate crisis impact. So I think it's more doing what Kelechi was saying in terms of efficiency, so reducing the inefficiency. And I think for that, he mentioned the number
lowering
of opportunities.
costs. Yeah.
A number of opportunities. Others, I would just flag, and I'm sorry, I might deviate a second here, but listening to Jan's comments, how do we also avoid competition across everyone who's fundraising out there? Mm-hmm. How can we be more efficient and avoid, using energy to fundraise when we can maybe consolidate those efforts? I don't know if it's even possible, having lived for decades within, the partnership of the United Nations system, but it's a question to keep in mind. To Gail's question specifically, I think there's two components there. One is, what can we do with other platforms to be vocal? Personally, I like LinkedIn. There's a lot of social media ones there also to find connections. But to your point on how can there be a marketplace for available expertise, I'm not sure that is aware. I think that is an idea that you're bringing forward, Gail, noting that some of the technical assistance in healthcare is highly, highly specialized. Like we're looking at specific vaccine profiles and how to administer that. So it's not something that I think an INSEAD profile is traditionally equipped with. But there's definitely expertise in efficiency, in operations, in logistics, in management that can be shared. And maybe, Katie, this is an idea that could be taken forward.
Yeah, I mean, it's a fascinating one. So we can definitely continue to play. Can people, in your humanitarian assistance role, Luke, are you open to taking suggestions from alumni on this call?
Always been, yes.
Okay.
It's, it's very useful. And I mean, there are a lot of alumni even in many countries in Africa, right? They've been doing well. They're willing to help. They're attached to the school. So it'd be good to have a club that, helps building local capacity, whether it's management capacity, which is, really needed in some of these countries. And also, simple supply chain management capacities, right? The fact that, where do you put the warehouses? How do you order things? How do you deal with stockouts? How do you simplify all of these things? Inventory management, basic stuff where that create an awful lot of problems because, the systems and the simple competencies are not there.
Yeah.
The problem with academics and MBA students from INSEAD is they usually go for too complex solutions. And many of the things are extremely basic, but you need to keep on working on those basic skills, management and other.
Well, would you mind throwing your email into the chat in case people there is a, sort of groundswell of folks who might want to do something in conjunction with your initiative. And then let's end with a question for Karen, which is related to community-based organizations and how can business be helping the community-based organizations? And connected to that is, do you see anything coming out of the G20 and the B20 in 2025 are related to advocacy for folks on the ground?
Well, if I respond especially to the localization, I think that's also been coming up. So I would go less for the advocacy, but I think if you talk about localization, I think it's really important, and that's what Dr. O'Hiri really laid out is we need local solutions because they're very tailored to the market. So in fact, if you think about supporting, also, how do you think about sourcing local solutions that are tailored to the ground and support those? And that can be business or non-business. And honestly, can be across the board. There was a question about, I think it was mentioned that nonprofits and social enterprises could play a role. And this is not short term. This is not the next 4 weeks or 8 weeks. But if we think a little bit longer term, and we say, how can we deploy that? How can we focus on rather scaling local solutions that have been proven? I think this is where a lot of support can come in. And that's also where we're moving a little bit away from purely humanitarian sector to some mix between for-profit, non-profit across the board. And I think that is where it becomes interesting, and that can be mobilization of investments into that scale, can be technology transfer. There's innovation out there that really allows to scale at lower prices, especially with AI supported basically healthcare solutions, for example. And if we think about, basically combining the local expertise that is there, and there's much more than I think we sometimes think about. And I think the Nigerian example really shows that if we can support that, I think that will in fact go a long way. And then using the grant dollars efficiently, if we can focus on the very poor population and for the remainder find basically more mixed models or even paid models which are supported by microinsurance, by microlending, we will be able to leverage the private sector much better. And I think that's really how we can think about that. And I think that's where the institute community in fact has a lot of expertise across the board, and where we could source much more broadly expertise that will cater to these different stakeholders.
Well, thank you for that, Karen. And I want to thank all the panelists. We're at time, so we'll need to close out. But this conversation to be continued. For those of you who have not signed up for the INDEVOR newsletter, we will, any ideas Veronica has for advocacy, Luke has for getting a skunk works together on tech assistance. They will appear in our newsletter. We have one coming out in Q2 toward the end of this quarter. And you can subscribe through your profile on MyINSEAD. We also I suggest you join our LinkedIn groups. You just go on LinkedIn, look for INDEVOR Global Impact Club, and ask to join, and we'll qualify you so that you can continue to get information on these conversations, and not only that, but opportunities for not only increasing your awareness, but joining in advocacy and action. We'll be soon announcing the Community Impact Challenge for 2025, which is an opportunity for all to take action. Thank you again, and thanks again to our sponsor, SATFA, and all of our co-promoters. Take care.